The theme for 2026 is Champion Your Health, which focuses on prevention, wellness, and personal responsibility, has a cornerstone of healthy aging. It encourages taking an active role in managing your own health, advocating for yourself, accessing preventive care, and making informed decisions that support independence. To honor Older Americans Month and align with this theme, we have scheduled a three-part virtual training series, with today being the first on financial wealth. They are all held via Zoom on each Tuesday of May at 2 p.m., with the final being May the 26th. In person, it's going to be a celebration, a tea party at Elder Care of Alachua County, their senior center here in Gainesville, and sponsored and catered by the Queen's Arms Pub and Bistro. To learn more about these events, please go to our website at www.agingresources.org. So let's now start with our panel. I'm excited and I'm really grateful and thankful for our panelists today. And so we'll start by having each of our panelists introduce themselves. And let's go old school alphabetical. And so we'll start with Stephen Crawford. Stephen, go ahead and introduce yourself.
I realized I was unmuted. Thank you, everybody, for going. Please unmute yourself. Hey, Stephen Crawford here. I'm a partner with Clarity Wealth. We are based out of Gainesville, Florida. We're a local and independent team of advisors who specialize across investments, financial planning, and retirement plans here in town. So excited to be here this morning. Happy to share anything else you want me to say.
Thank you, Stephen. Next, we'll go to Rachel.
Hey, good afternoon, everyone. My name is Rachel Debigare, and I'm a financial advisor and certified financial planner. I joined this business about 5 years ago to work alongside my dad, and together we formed what's called the Stimler Agency, which is where I'm now the principal as he has retired. And so I've spent a lot of time talking with folks and seeing him firsthand make the leap to retirement. And I'm really excited to be here. I love working with all of our clients. I think that's one of the best parts about being a financial advisor is just getting to meet people and help them navigate their individual journey. So I'm happy to be here and thanks for the invitation.
Thank you, Rachel. Cheryl Harris, please introduce yourself.
Good afternoon, and thank you for the opportunity to share today. As Katina said, I'm Cheryl Harris. I'm the SHINE Liaison here at Elder Options. SHINE is an acronym that stands for Serving Health Insurance Needs of Elders. I've had the privilege of being in this position for 11 years, and I love what I do. And thanks again for the opportunity to share.
Thank you, Cheryl. And last but not least, we have another Stephen, but Stephen Walker.
Good afternoon, everyone. My name is Stephen Walker. I'm a certified financial planner professional here in Gainesville, Florida with Edward Jones. I am from Gainesville, so I always volunteer at the opportunity to pour back into the community to make sure we're all, making sure we grow together. So I'm excited to be here with everyone.
All right. Thank you so much. And we'll start with our first question for all the panelists is, what initially drew you to a career in wealth management, financial planning, or overall working with older adults, and what continues to motivate you in this field? So we're going to start with you, Stephen W. Since you were last, we're going to make you first.
There we go. So I feel like I can't answer this question without going back to high school. So I was fortunate enough to go to a high school that had an Academy of Finance inside of it. And with me being in that Academy of Finance, that school had a credit union inside of it. So I ran the student-run credit union with a couple of other students, which allowed me to work at a local credit union during the school year part-time and full-time during the summer. So that was my entry into financial services, and one that allowed me to get to know a wide variety of different people. And I begin to build skills. And even though I'm young, I can connect with different people across, different generations. So that's where it started. Graduated high school, went to go and work for two of the largest banks in the world, which again led my exposure to financial services. And finally, I got the opportunity to transition into wealth management. So for me, I continually believe like I feel like I'm making the biggest difference on this side of financial services now. And not to say that retail banking, is bad. It did mold me, but for me personally, being able to sit down with people, have conversations with them during their most vulnerable moments, that is what it truly means to be a financial planner, and to work with older adults specifically because that is a client segment that is vulnerable. So you have to talk to, that client segment and make sure that we're building trust, so that we can continue to serve them well.
All right, thank you. Interesting. High school, wonderful. Sure, what about you? What initially drew you in this arena and working with older adults, and what continues to motivate you in this field?
Well, as I've looked back in what I refer to as my chapters of life, because there are different things I've done across my many years, is the fact, and it's just amazing when I look back how I've always been connected to senior adults, either through personal care with seniors or professionally and working in long-term care facility, and just seeing how it just greatly impacts families as what's happening in those senior years, either to the person individually or to their families and caregivers. So I have such a privilege of working here at Elder Options. I tell folks I had the best job in the world. I get paid to help people and help families understand this journey that they're currently on. And it's always rewarding when you hear families and Medicare beneficiaries say, I had no idea. So it's great to do what I do, and I find it very rewarding.
Thank you, Cheryl, and we love having you at Elder Options. I don't know what we would do without you, so no retirement for you from us. What about you, Rachel? What drew you in your career and why you continue to motivate? What continues to motivate you in this area?
Yeah, absolutely. Well, kind of a mix of what Stephen and Cheryl have already said. When I look back at the early part of my career, I actually started after college in the nonprofit sector, and I worked there in a local nonprofit for 12 years and ended up as the executive director, which I loved. I did a lot of fundraising, but I also really got to develop relationships with our donors while feeling really good about the work that we were doing. So when I decided to join my dad, working with him and alongside him was a really big motivator for me. And I was at the time of my life where I was looking to make a change. But what has really kept me has actually been similarly to what I enjoyed in the nonprofit sector, even though the jobs are different and a lot of people wouldn't think that they're the same, but the deep relationships that I'm able to form with my clients. And although we're not working for a specific cause, but in a way helping each client reach their specific goals. And one of those things that I really love is helping our clients feel empowered to where they understand. I'm sure Cheryl probably derives a lot of satisfaction as well from that. Is it's very satisfying to realize that you've helped somebody understand what their options are, understand their finances, what they own, what their budget is going to look like. And I really derive a lot of satisfaction from that. And when you really start to feel like your clients are part of your family, you get to know them and share intimate conversations together. And that's something I really enjoy about this field.
Thank you. I love what you said about really helping people is focus on what they want their retirement to look like. The person-centered approach that is so important. And Stephen, what about you? What drew you into this arena and working with older adults?
Well, I love that, Stephen. You had it early on. I don't know the rest of our crowd. Did learned little to nothing about personal finance. I came from the School of Hard Knocks, and it really. So I told the group before I got in here, I'm actually a licensed civil and structural engineer turned financial professional. Found myself going the path of the rest of the world, deeply, deeply in debt, out of control financially in my mid 30s with a wife and children. We got on Dave Ramsey's plan, and it changed my world. We paid off a tremendous amount of debt. It ignited a fire and a passion. We were out teaching classes to anybody that would listen, through our church, through all these different things. And my wife came to me one day and said, "Hey, I'm not going anywhere, but you're not checked into me or your kids. You need to do something different."
Mm.
So after being in engineering for 17 years, what am I going to do? And she's like, "You love personal finance." And so started going down that path, and then talking to my parents and them going, "Hey, nobody gave us guidance on investments versus insurance products versus Social Security versus Medicare." So it just snowballed into this thing that my wife and the Lord said, "You need to go do that." So since as a recovering engineer, I really enjoy the tax piece of it. I am an enrolled agent. We think that taxes just touch so much on that. And so as the rest of the panel has said, like as we start to age, things change. And really there's a paradigm shift when it comes to retirement. During our working careers, we have income coming in and we have expenses going out. It's kind of a two-way door. Once we hit retirement, one of those doors closes. Now, all of a sudden, we don't have that normal income that we're used to, but we still have expenses going out. And having this shift and all these different things change and helping clients through all that is a continual problem that is fun to solve and keeps me motivated as I look forward.
Well, I'm glad you're here. You're recovering from, you said, recovering engineer, so
The
I love
recovering
that.
engineer. So if I get a little nerdy, I apologize.
All right. So, what are the most important factors someone should consider when deciding to work with a financial or insurance professional as they approach retirement? Let's start with you, Rachel.
So, of course, credentials are important, and having somebody that you feel is got the experience and the knowledge. But to be honest, when you ask the question of most important, I really think it comes down to trust and somebody that you feel you can trust. I mentioned earlier, and both Stevens touched on this. I mean, you really are walking with somebody through a huge part of their life. Sometimes these relationships can last, 30, 40 years sometimes. And you want to make sure that your advisor is working always in your best interest and that they're trustworthy and you can share details with them. If someone's really going to help you with your finances, you're going to have to tell them a lot of things and really be open and honest with them. And so when you talk about one of the most important qualities, you really want somebody that's you feel you can trust and has integrity, and of course has the proper experience and knowledge, but really somebody that you can develop that long-term relationship with.
All right, thank you. Cheryl, what about you? What do you believe are the most important factors?
Well, especially with Shine, we're considered unbiased and confidential. We're not going to sell your information to any other marketers we don't make a commission. Our goal and our mission is all about informing people. So we want to make sure that people, and we tell this regardless of what field you're in, never feel pressured to make a decision. You need to feel comfortable with that decision, and you need to make the decision that's right for you. Talking to neighbors and family members about what their choices were, especially when we're talking about Medicare and making those health insurance choices. Listen to others, but don't base your decision on what others have said. You need to find what works best for you in your situation. And where we see many people fall into scam situations because they felt that high pressure, that sales kind of pressure, and that's when making those decisions at that moment can lead you down a path that you often regret. And with our program, that's what we're here to do, is give people information and education.
Thank you, Cheryl. Stephen C., what's your thought on this question?
Everything, Rachel, that you said, wholeheartedly trust in relationship. Cheryl, I love the education and the no pressure. Absolutely. And that's hard the way you asked that. Like this one thing I will add on to what Rachel said is just making sure that whoever you choose to work with, can clearly communicate and simply explain it. Don't try to get lost in, well, trust me rather than understanding it. That's certainly there. But I also think the way you framed the question, I'll kind of answer to that. You said, work with a financial or insurance professional. So it's important to understand what type of relationship do you want to have with your professional? Do you want a transactional relationship where they're maybe selling you a product? Or are you looking for an ongoing relationship where you're paying more for advice and ongoing support from that standpoint? So I think that's a pretty important nuance to make sure that you know how the person you're working with is getting compensated, because you want to make sure that there's no conflicts of interest, and that should be completely transparent. It's not that one's right and the other is wrong, but there should certainly be that transparency. And I know you said just one, but I certainly think a multiple discipline, whoever you're going to work with, we want to know about investments. We want to know about taxes, Medicare, Social Security, all of these different things can serve in a robust manner for all these really important things that come up in retirement.
Thank you. That was excellent. Stephen W., what's your thought on this question?
Man, y'all are too good. Y'all are too good. So what I will add to what has already been said, trust, education, I think it's our job, like Stephen said, to explain these somewhat complicated things in a way that is digestible for our clients. So for me, if you're looking to be educated, that insurance professional financial advisor that you're seeking should be leading with education. An advisor should be leading with questions and not solutions, because that education is going to lead to you being empowered, and that's going to also lead to action. So, that I'll keep it short. That's what I would add.
All right, thank you. What is the biggest misconception or myth you encounter about aging and saving for retirement? So we can start with you, Stephen W.
So I think from my time in wealth management, the misconception comes from it's not the right time. It's not the right time, or I don't have enough wealth for financial planning. And Stephen kind of hinted to it, and Rachel does this, I'm sure, at a high level. Financial planning isn't one singular thing. Financial planning is talking to you about, what your goals are and defining those goals. Yeah, it's one thing to travel, but how often are you traveling? How much money is that going to be? Who's with you? Who's at that dinner table when you're at the beach? Do you have a good understanding of your budget, what's coming in and what's going out? Do you have an estate plan? Have you talked to an estate planning attorney? Do you have protection in the forms of insurance? And honestly, investments is important, but it's table stakes. That is one thing that we will do at a high level. But for misconception is, financial planning is just investments, but it's so much more, and there's so much more that we need to make sure we address with clients throughout their lifetime.
Thank you. Rachel, since Stephen mentioned you, what's your thoughts?
Feeling this is going to happen a lot as we're sort of building on what the others are saying, which I love. And something Stephen talked a little bit about budgeting, and I've sat across a lot of kitchen tables talking to people, and they are wondering, do I have enough money to retire? Almost as if it's a question they can never know the answer to, that it must be some shot in the dark that, oh, maybe, we'll figure that out, or I'm just going to have to keep working. But the fact is, with working with a professional, you can kind of hammer down, you can understand what your budget is and really come up with some goals and understand what you need to retire. It doesn't have to be a big shot in the dark or a big question mark, or, well, I'm going to retire and just hope it works out. So I think that's one misconception, is that, and then I would also say, maybe on the flip side, that you talk, and I'm sure we'll talk a little bit about this as it goes on, but just that it's not one size fits all. That if what someone else's retirement budget, or what they're drawing from their IRAs or their investments or savings on an annual basis, that doesn't have to be what you're doing. And I think some folks think it's, there's some specific percentage point you need to look at or whatnot, but it should be very tailored to your unique family and individual situation.
Thank you. Cheryl.
Well, my last questions that I did not beyond is
Oh, now you're breaking up. We can't hear you completely, Cheryl.
okay. Is that any better? Okay. So in my field, when working specifically with Medicare, related to what Rachel just said, is one size fits all. And that is absolutely not true when it comes to Medicare. But some of the things that I frequently hear is that, I'm 65 and why should I be worried about the choices I make with Medicare when if I'm starting Medicare at 65 or whatever age, if you worked beyond your initial enrollment period. But the choices that you make when you're initially enrolling in Medicare can have long-term impacts and with your situation. So again, we want to stress being an informed consumer, understanding the ramifications of your choices, and not wait until life happens when you're much older and then you want to make different choices. So that's knowing that when it comes to Medicare. And I'm just always amazed when people say, well, I thought Medicare was free. All the commercials say, it's free, free, free. And so, again, our role is to educate people on that. And another common misconception is that people think that Medicare is going to pay long term in a nursing home. Medicare does not pay for custodial care or that residential type care long term in a nursing home. So we always want to make sure people understand and have appropriately planned when it comes to financial. We don't do that financial planning, but we want to make sure people understand the limitations of what Medicare does cover. And I'll stop with that because there's a long list.
Thank you, Cheryl. Stephen C., what's the biggest misconception or myth you
Yeah,
encounter about aging and saving for retirement?
I reinforce everything that Mr. Walker and Miss Rachel has said. And Rachel, you hinted at it. Like, let's be honest, money's emotional. It can bring
Mhm.
joy, it can bring fear. I don't know about the rest of our audience. I've had sleepless nights over money. And then we go to talk through these things. Like, those are really, really hard. But Cheryl, I have to follow your lead. I'm going with Social Security. I love that you hit Medicare. Social Security is very much the same thing. Is it this misconception that there's one correct age to claim benefits. There's headlines that say, if you don't take it 62, you've missed the boat. If you don't take it 70, you made the absolute wrong decision. The reality is it's individualized to you. What's your marriage history been? Are you still married? Have you lost a spouse? There's so many factors into this that what is Social Security going to pay out for you? What is the right claiming strategy? And it comes down to every individual person because very much like Medicare, you get a 12-month window to claim Social Security, untie it, and then you're stuck with it forever. It's a one and done with a 12-month grace period, and you're done.
Thank you. So I'm gonna start with you, Stephen Walker. Aging in place is a goal for many older adults. Most of us want to age at home in our communities. What does it really take to make that work financially? Even if you want to add socially or physically in terms of health, finances, and insurance coverage.
Yeah, I think we've all hinted at it, and it starts emotionally first. Before we're even talking, about actual numbers with clients, I feel that it's my job, especially if it's someone who's getting ready to retire or living in retirement and they haven't had this conversation yet. How can I connect my client's money to what their purpose is? Because everything else tends to take care of itself afterwards. So we tend to frame the conversation between health, family, purpose, and finance. And having those conversations with people allow us to then, live out a quote unquote healthier life. Because the reality is, there's various articles that we can find online is that people that have a quote unquote healthy retirement are the ones that are healthy physically and mentally. So how can we focus on that and then transition to, making sure their financial plan is set up appropriately? So I always talk to clients about lifespan versus health span, and talking through that first, and then transitioning to, making those financial decisions that we need to make.
Okay, thank you. Rachel.
Yeah, so I know we're going to touch on this a little bit further, so I'll just say I'll keep this answer a little bit brief. But I think what it truly takes if you want to age in place is really to start having some open on and honest conversations with your spouse, with your family, or potential caregivers, just to really help make sure that they understand what your goals and wishes are, and also allow them to think through, is that realistic for me? Can we help with this? And then from there, kind of figure out, okay, what financial resources is it going to take to make that a reality? Do we have those resources? What, policies, the question mentioned, health and insurance coverage. So what types of insurance coverages are out there? Do we need, is there something that can help with that? Is it too late for that? And I think, but really just starting with identifying what does aging in place look like? How long is that realistic? And then forming a plan around that and going ahead and having those conversations with the folks that you're hopeful are going to help you, make that a reality.
Okay, thank you. Stephen C.
Yeah, I would say back to what Mr. Stevens said, you got to have a budget and know what those costs are going to be. Because at the end of the day, going into the question talked about, physically, like some upgrades or changes you're going to have to make to your house, right? They're easy to think about, but they're expensive to put in. And as we age, we're probably not going to be doing that ourselves. But I want to hit a little bit more on the socially and logistics side is who's going to provide my support? And as we get older, what am I going to do about transportation? How am I going to get it to my medical appointments? And Rachel already talked about this. Who's going to provide advocacy on my behalf to make sure that I'm taken care of if I'm not? We see it with clients all the time as the decline starts and they're like, I need help here, but I've lost my spouse and my kids are across the US. Where do I go for help? Who can do this? Client was telling me she was getting IT tech support on her computer from her lawn guy. Well, he's young and he knows computers. And I'm like, oh my gosh, he could steal every piece of data you have. And it was honest, and it's not coming off as judgmental, but it's like, whoa, let's unpack this risk and talk about it. So I'd like to add that in.
Absolutely. Thank you for that. It was a good point. Cheryl.
Again, building on what others have said in those open conversations, and I am walking this road with my mom right now, so I'm speaking
Mhm.
from personal experience today. Again, it goes back to the fact of these open conversations, and they're hard. They are hard conversations when you're in the middle of it. And it's, even though I've done this professionally, you have to start that conversation. And even when maybe your loved one doesn't want to have that conversation, but as I'm working with families, I tell them, okay, learn from your experience and you need to apply that to self so that when you get to that point, you've already appropriately planned. But it does take a team effort in understanding that those choices, and you need to have the planning can make other opportunities available for that aging in place because it can be costly. But it starts with those open conversations and letting your family know what your desires are. And then also, again, making sure your family or trusted individuals have access to your information and know what types of coverage and policies that you already have in place.
I want to follow that up, Cheryl, what you said with another question. So, long-term care is one of the largest expenses in retirement. What options are available and how should people be planning for it?
Well, that is topic that Shine offers uh, an hour and a half long class. We offer monthly virtual classes, and one of them is called long-term care planning. And we are just so privileged to have two of our Shine counselors teach that class on a monthly basis. It's going to be held in May 28th at 10 a.m. And this is a virtual class. And I won't go into a lot of in-depth conversation on it because we offer that. And just know, I think Rachel or someone talked about understanding if you have a long-term care policy, understanding that policy. One of our counselors used to say, if you've seen one long-term care policy to help cover with cost, you have seen one long-term care policy because they're all different. And every policy has different procedures in place and they're applied differently. So another thing along these lines is understand the policy and what the limits are on that policy and how they are enforced.
Thank you, Cheryl. And we've included, Lisa, did you include the link for that workshop if individuals are interested in it in
I'm
the
working on
chat?
getting that. Absolutely. I'm working on getting that in the chat right now.
All right, thank you so much. So let's go to Stephen C. related to that question. Long-term care is one of the largest expenses in retirement. What options are available and how should people be planning for it?
Yeah, I'll zoom out a little bit and go kind of there's two major options when it comes to long-term care planning. Number one is, hey, am I going to self-insure and go, I've got this covered? Or number two, do I want to transfer the risk of that cost over to some kind of insurance? And so self-insuring, I'm going to use my own assets. I'm going to carve that out to pay for this what if versus insurance is going to be used to offset. And I love what you said, Cheryl. If you've seen one, you've only seen one. Because when you look, if you say, hey, I want to go the insurance route, it's important to understand that not only are there different types of policies, but then there's also all different vendors, and each one has their own bells and whistles. And then you get into this maze of confusion. It can feel very, very overwhelming. The benefits are completely different. So, going back to Cheryl, what you said earlier, it's extremely important to become an informed consumer. So, it sounds like that webinar that Shine does could be extremely helpful because most of us are used to insurance, auto insurance. I pay for this thing and I never use it, right? Like this is really frustrating. I paid for my house insurance for 40 years and it's never burned down. Unlike those kind of risks, long-term care, that's like a 50-50 chance that any one of us on this call is going to need it. So there's a very, very high likelihood that it's going to happen. So planning for that, understanding the trade-offs with each is really important and critical when it comes to looking at options and planning for it.
Thank you for that. Rachel, we'll go to you next.
Agree completely with what Steven said about kind of the two options. Either you're going to pay for it with assets that you have and have deemed that that's what those are going to be used for, or you look at different either long-term care insurance policy options, which can be either a standalone product, meaning the insurance policy is specific to long-term care and it kind of carves out what it will cover, how long it will cover for, how much it will pay, all things like that. There also can be hybrid options. I will say long-term care insurance is expensive. And that's really because long-term care is expensive. And so we have some clients now where the parents are maybe in their 70s and 80s and utilizing a policy that my dad sold to them, in the 90s and early 2000s. And I'll tell you, it's a blessing to those families. The policies are being used the way they were designed to, and they've relieved a big financial burden. And so now their children who are in their 50s, trying to think about, well, is this a product I want for myself? And some people, the price it's extremely expensive to buy those policies in the year 2026. And so while they are an option, they are certainly not they're not super affordable. But again, that's, really because the cost of long-term care has gone up. Some life insurance policies also have riders that can be attached to them that help you pay for long-term care. And so that can also be helpful. Stephen said, it's kind of a 50-50 shot. Some people could need long-term care for several years. Some people might not need it at all. And so sometimes people will choose to purchase a life insurance policy that has some long-term care qualities so that if they don't use the long-term care aspect of it, then their family would receive at least a death benefit should they pass away. Again, that also costs money. So it's really about the best way to deploy your assets. The Medicaid does cover these costs. I know Cheryl mentioned there's a huge misconception that Medicare covers a lot of things that it doesn't, but there's real specific terms about if Medicaid's going to cover it, who's going to accept that, and how much of your own money you have to spend before you can count on Medicaid to pay for it. So it's certainly long-term care planning is certainly really important.
Thank you. Stephen Stephen W, sorry.
No, I mean, y'all touched on it, self-insuring versus traditional long-term care insurance versus hybrid policies that are long-term care focused, but have a death benefit, life insurance with riders that, would help us with long-term care things. What I would add to that is the educational side of sitting down with your family, sitting down with your loved ones and asking, how would I want care? How would I want my care taken care of? Is it people coming into my home? Is it assisted living facilities? Is it skilled nursing? Because we all know that each of those options, there's a varying level of cost. So if you're not working with a financial advisor, there are tools that you can use, like Care Scout is one that comes off the top of my head. You can Google that and start to see what these costs are in your zip code. So I often think we need to start with what level of care we want, realize what the cost is, and then try to find what the solution the best is for you.
And what was that called again?
Care Scout. Yep, just Care Scout in Google, it'll come right up.
Okay, thank you for that. Beyond Social Security and Medicare, what do you recommend for building a reliable and sustainable retirement income? And let's start with you, Rachel.
Goodness. This is kind of a trick question, I feel, because once you're in your 60s and 70s, it's hard to build a new income source, to be honest. That's a better conversation for earlier planning. But since we're talking about it at this age, that's kind of when you look at, okay, what if I worked or my spouse worked, what retirement options were available to them? Do they have do I or my spouse have a pension? Are we utilizing does he have a 401k, or does my wife have a 401k that we can utilize? So it's about kind of looking at all of the assets available, really. And yes, looking at Social Security and Medicare, but then what are other resources really that are coming from our family that we can draw on at different times of our retirement life cycle to pay for our expenses. And there's different products. If you want something, a lot of times when you hear reliable and sustainable, people might think about annuity products, things that are going to build have an income stream. But you really think that's where working with a professional comes in and helps you assess what you have and really to be able to make a plan.
Okay, thank you. Stephen Walker.
So yes, we're starting with, that quote unquote mailbox money. Do we have Social Security coming in? Do we have a pension? There's an analogy that we like to use with the three-legged stool. Maybe in the past people were coming in with savings, Social Security and pensions. But that third leg, not a lot of people have access to now. So I think this
Mhm.
question is positioned in that respect. So how do we create that third leg of the stool to make it, make our retirement life, quote unquote, more stable? So, if we, looking past things like, annuities that create guaranteed income, maybe it's starting with our IRAs and maybe we have a required minimum distribution that's coming out. So that's money that we're having to take out according to, the rules right now. So that is money that we can bank on having every single year. Having the appropriate amount of cash on the sideline in retirement, and making sure that cash isn't sitting there, making sure it's earning interest or in a CD ladder type portfolio. So, I can understand what Rachel was saying about kind of a trick question, but we kind of have to start from, the ground up to make sure everything is getting addressed with your income.
Thank you. Stephen Crawford. Beyond Social Security and Medicare, what do you recommend for building a reliable and sustainable retirement income?
Yeah, I'm going to go with Stephen Walker on this and assume that there's things other than Social Security and Medicare. Rachel, you handled that so well. But it really comes down, I think, to a couple different things. Go zoom out a minute again, go personal preference. Let's assume I have this other thing over here. Do I like the thought of investments that have a risk of loss? Maybe I do, maybe I don't. Maybe I don't like that at all, and I want some kind of contractual guarantee. Those two decisions are going to kind of point me in two different ways. And unfortunately, there's not a silver bullet in the industry. There's trade-offs with everything, but a common framework is how do we take different income streams and go, okay, what's going to handle this near-term immediate liquidity needs? What's going to give me some intermediate inflation protection, meaning I can still buy the same amount of stuff with the dollars that I have today? And what's going to give me long-term growth? And the sandbox I really enjoy playing in is the tax sandbox, is then how do we beat the tax game with these income streams to make sure that you keep as much of your money in your pocket and we disinherit the IRS as much as possible. Legally, of course, we're talking tax of avoidance, not tax evasion. But it's really frustrating. I've got the Social Security income that I've earned for 40 years. Now they're going to tax me on it again because I have these other income streams. That's a real problem.
Thank you. And Cheryl, do you have anything you want to add to this question?
Well, just a snippet in the fact that rather than income, when it comes to Medicare, we want to remind Medicare beneficiaries and families think about the outgo when it comes to Medicare cost. So it's
Mm.
really important to annually visit your Medicare options and see what is available for you in your area annually. The open enrollment is October 15th through December 7th. And
Mm.
people, going back to the misconception, is my plan worked great for me last year. Why is it working the same this year? Why is my medication costing more? So that's why we want to, part of our role is to look at the outgo of making sure that your prescription drug plan is the best. When we say the best, meaning the lowest cost option for you in the coming year.
Thank you, Cheryl. And we have probably about 15 minutes left. And if any of our guests or of our audience have any questions, please go ahead and put them in the chat now. But a lot of the conversation has centered around having honest conversations with families and caregivers and things like that. What advice would you give to families trying to have honest conversations about aging, healthcare planning, insurance coverage, and long-term financial security? And it's buyer's round. Whoever wants to go first, put your hand up first. Whoever wants to go first. All right, Rachel.
All I'll say is that I truly think one of the best gifts that you can give your family and your children is having these conversations sooner than later.
Mm.
I think sometimes there can be a school of thought where you don't really want to tell them, you maybe don't want your kids to know to talk about finances within your family. And I mean, they don't necessarily need to see your bank account, but although I can tell you there's sometimes where that would be helpful. But the more that you can speak openly and honestly with your adult children about your wishes, plans for aging, what policies you have in place and what they could do. I spoke with somebody, I don't know, in the last year who her mother had died probably 5 years ago and had still the woman had still not collected the death benefit from her mom's insurance policy. It was like this
Wow.
was why, and some of
Wow.
that just comes that they don't know these policies are there, or it takes, the financial professional reaching out once they haven't heard anything in a while. And so, having those conversations that way, also your caregivers feel empowered. Once we've talked a little bit about going to see an estate planning attorney, making sure that you've got your proper documents in place. You've got your last will and testament. You've got your living will. You've got a power of attorney, or plans to have one. And so, allowing the people who are going to be working on your behalf to understand what you want and what your wishes are, while you're able to really articulate that, is, I think, to be honest, I really do mean it when I say I think that's a true gift.
Mm, thank you. Good advice. Stephen Walker.
Yeah, piggybacking on what Rachel just said, I think I would say if you're working with a financial advisor, it is our job to help coordinate that family conversation. It
Mm,
is our job to understand what your relationship with money is and maybe what the hesitance is to have that conversation with family. And there's this piece that anybody can look up. It's what is the value of a financial advisor? And our mind typically goes to asset allocation, making sure I have the right mixture of ingredients. And while that's important, that's actually the lowest percentage.
mm,
Next is behavioral finance. So we are coaching you through markets up and downs. Next one is client family meeting. So client family wealth generational transfer. So helping you have these conversations about making sure you understand how you view money and asking yourself, do you want to pass down a different type of money script to the next generation? And we
mm.
understand as advisors that different generations, baby boomers to, what is it, Gen Beta now, are going to view money differently. So that is why we continue to have that educational conversation.
Thank you. And Stephen C., you're up next.
You get the power of choice. If they call it personal finance because it's personal to every one of us. So you have to sit back and go, hey, do I want to be proactive, or do I want to be my family to be reactive when these things happen? And both Mr. Stephen and Miss Rachel kind of hit on that, is that our goal is to help or try to facilitate these conversations. Yes, it's good for the client, but we also have perspective. We see the clients who proactively communicated with the next
Mm,
gen. And yes, the
mm,
conversations were awkward and they were hard and nobody knows what
mm,
to do. But when mom and dad aren't there anymore, there's peace, there's
mm,
flowing of just we know what the process is versus mom and dad told us nothing. We're
mm,
searching for all of this stuff where we have no idea. And mom and dad weren't trying to create a hornet's nest on the back end, but the way the probate system works and all of it's inevitably going to be a hornet's nest because there's stuff everywhere. So you have the power of choice. Do you want to be proactive on it? Do you want to be reactive? Certainly, if you're working with a professional, let them be the bad guy. This guy, Stephen Walker, told me we had to have this conversation. Like use us the way you want to use us. But if you're not working with a financial professional, just go to your family and go, hey, we need to have a really awkward conversation. So let's do it over dinner or something. You let me know what is the best forum to have this. Don't just lay it on them over Thanksgiving dinner, right? Nobody wants that.
I love that advice. I'm gonna use that with my parents and see if that works. Cheryl, what's your advice?
Again, these open conversations, in addition to financial planners, also work with the family doctor or their primary care
Mm,
doctor,
mm,
or if they're seeing a geriatric care doctor, to encourage these conversations. And sometimes sometimes it is the family physician that can broach that subject and really um, sometimes, especially older seniors will listen more in that regard. I also, in my family situation, I use others as an example of what we do not want to face as a family. And I know that's approaching it from a negative standpoint. And personally, I don't like approaching it from that standpoint, but I have had this actual conversation, Mama. We don't want to wind up how you see a neighbor or extended family member, how things have wound up, and there are so many hurt feelings within families, and you don't want to leave that legacy for your own family. You want to have expressed appropriately what your desires are, and we want to make sure that we honor your legacy in that regard.
Thank you, Cheryl. I think that's an excellent point. We probably everyone on this call could probably think of a situation that was a truly difficult situation. We don't want to be in that situation. So thank you for that. Lisa, I just want to check in. Do we have any questions from our audience?
There are no questions in our audience right now, but I do have a question from a nonprofit that I would like to ask, specifically having to do with charitable giving and giving back to the community. I know that question must come up quite a bit. And how do you manage those conversations? How do people generally approach you for those conversations? And anybody that wants to take this can.
Speaking from a nonprofit.
Speaking from a nonprofit, I'm showing all my cards. I am the nonprofit.
Yes.
Yeah, I would say it's about knowing the landscape. So if you do have an urge, to support nonprofits and a philanthropic interest, there are tools, the local community foundation in Gainesville has tools for you to do research on the nonprofits and what, area they're serving. So I would say start there to really, again, realize what your purpose is. So you can put that on paper before you start, sending money to different places. And then you weaving that into financial planning, just starting with things, knowing the different, avenues that you can support those nonprofits with your money. Speaking about qualified charitable distributions, donor advised funds, not getting too much in the weeds, but, there are different things that you can do with your money to make sure your charity of choice is supported.
All right. Who else? Rachel, you want to add anything to?
Yeah, I agree everything that Steven said, and I think it really goes hand in hand. It's not necessarily as an advisor, it's not our job to say, hey, there's this great charity, you should give to it. But it's really about being there to facilitate the conversation of, what is all this money for? What do you want to do? What do you want your legacy to be? Are there organizations that you're very passionate about? And if there are, what are the different options? You can leave, some assets to a charity after you pass away. Can be put in your will. Or, do you want to watch that gift take place? And what are the best ways? Maybe Stephen talked about a qualified charitable distribution and donor advised fund. Completely agree. Locally, our community foundation of North Central Florida is a wonderful resource. Um, Even just, stock that has grown a lot can be great to give that away instead of having to pay the capital gains taxes. There's so many different, and again, this isn't the spot for all the nuances, but there are. Stephen Crawford said, "Great. It's certainly not it's tax avoidance, not tax evade. How are we being smart about the taxes that we're liable to pay, and what's the best way to do any sort of transaction to make sure that we're being obviously completely above board about it, but what's the most advantageous way while also supporting your local community and your local nonprofit."
Thank you for that. Stephen C.
Yeah, I'll jump in there. And kind of to what Rachel said is that not all assets are created equal when it comes to charitable giving. So if I'm looking at end of life, there can be really good assets to leave to a charity. There can be really bad ones to leave to charity because they're taxed differently. And as a nonprofit, you have more tax advantages than an individual does. So when we look at an overall plan, it ties back to taxes. Secure Act 2.0 changed the name of the game on using trusts and how do we leave assets to different people. And it's really favorable now
Mm.
to nonprofit organizations if you're charitably inclined. But I will plug what both Stephen and Rachel said. If you're on the call today, if you are taking RMDs, and you are giving to a church, a charity, or something, and you are not using the qualified charitable distribution strategy, you are giving more money likely to the federal government than you are legally required to. So you need to
Hmm.
unpack that and understand how can I both give and take these RMDs and pay less to the federal government in taxes.
Thank you. Thank you. And it looks like we do have a question in the chat, so I want to make sure we address that.
It
Go ahead.
says, it's from Ronnie, and it says, much of what we're talking about seems geared towards older people with a certain amount of financial resources. For those who basically don't, what recommendations do you have for them?
Anyone want to take that? Anyone wants to jump in?
I'll jump in on that. I think in the beginning of I forgot what question it was. One of the misconceptions of financial planning, I think anyone can benefit from realizing what their goals are, defining their goals, coming up with a budget, asking yourselves, do I have somewhat of an estate plan? Do I have the proper forms of insurance that is auto, life, home, across the board? And then talking about what you're working with savings and investing. So I would say there's a benefit from realizing that and having that conversation with someone if you haven't had it facilitated in a way that a financial advisor might. So it's not all tied into assets. I truly believe that financial literacy and education, people can benefit from having that conversation and those type of skills and habits passed down generations.
Thank you. Anyone else want to add to what Stephen has already said?
Yeah, I can piggyback on that. That yes, when you look at the whole financial picture, and we work with a ton of people that hoarding a bunch of money, if I can use that term, that has a negative connotation. That's just not been important in their life journey, but they still want to make sure that they have a plan that works, that they're paying as little as they need to on some of these things that they have to have in place. And so you can find flat fee planners that go, I don't care. Money doesn't define who we are. It doesn't. It's a tool and we need to go, we all need help. And how do we find that? And there's different paths to get there. So I hope that answers the question.
Thank you. Anyone else, Cheryl or Rachel, would you like to add anything?
Just to say, and even using Cheryl as an example, I think there are so many resources available. Yes, I agree with both Stevens that it's still, even if you don't have a tremendous amount of assets, being, talking to somebody and really understanding what you have and how you are going to pay for your expenses and where those dollars are going to come from, understanding, making sure you have a good understanding of all of your streams of income, Social Security, Medicare, all of these things, or any other assets that you have, understanding what your options are for Medicare, understanding, what those costs are, taking advantage, even just being on these types of calls and taking advantages of the free resources that are available to you, I would say is a great place to start. To really feel confident. The biggest thing, and we've all touched on this, is that each person feel confident in where they are and where they're headed, and there are certainly a lot of ways to do that.
Thank you. We are at the 3 o'clock hour, and I want to just thank our panelists for their time and the valuable information they've shared this afternoon. I've learned a lot, and it's given me a lot of food for thought and some conversations I need to have with my family. But also, I want to I know we're at 3 o'clock, but just if we can take just 1 minute, and each of the panelists, if you want to drop any nugget or any information as we close that you would like to share with the audience. We have included all of your contact information for the audience in the chat, so that's in the chat. But I'll start with Cheryl. Is there any nugget you would like to leave with the audience today?
I tell folks the Shine program, we are your tax dollars at work. So please come and enjoy those resources that are here for you to use. You've already paid for our services with your tax dollars. We have counseling locations in all 16. We have counseling locations and opportunities to connect with local Shine counselors in our 16 county region that we serve. The Shine program is throughout the state of Florida as well. It is a national program. So if you have a loved one in another state, we can connect you with our sister program in other states. We look forward to serving you.
Thank you, Cheryl and Rachel. Any last nuggets you want to share?
Just that one, thank you so much for your time today and for inviting me. But I think if there was one final nugget is, it's never too early, but also never too late to really start to have these conversations and really feel, never too late to feel empowered about what your plan is, to have these conversations. And I agree with what both Stevens have said about engaging an advisor to help you with those conversations.
Thank you. Stephen W.
Yeah, they say that the best time to plant a tree is 20 years ago. The next best time is today. So, just if something resonated with you, just taking action and making sure you know those resources that are there to support you.
Thank you. And last but not least, Stephen C.
I'll reiterate. Thank you for the opportunity. Everybody gave us so much time. Excited to be here. We started with, hey, this thing's about taking personal responsibility. I think, Katina, that's one of the things you said. And Gene McCown in his book Essentialism says, if you don't prioritize your life, somebody else will. So on my way out of the house this morning, I had the wherewithal to grab this book. And it's called The Retirement Planning Guidebook by Dr. Wade Pfau. I have no affiliation with this guy other than he wrote an exceptional book. So if you're a self-learner, we've talked about resources out there. One of my favorite things about there is it deep dives into everything, Medicare, Social Security, and there's great checklists on the back, like do this, avoid doing this. So for those self-study, check out, I bought this off of Amazon, Retirement Planning Guidebook, Wade Pfau, for self-learners. Check that out if you ever have questions. I'm sure any of our panelists, including myself, will be happy to answer questions for you.
Oh, that's wonderful. If we can get the information for that, we can send that out. Lisa has kind of closing and thank you. And Stephen had a resource too, he mentioned earlier, so we can send that information out. And thank you so much for your time. I've learned a lot. I appreciate just your interest in the topic of financial wealth and championing your health. And you all have a wonderful rest of your day. Bye-bye.
Thank you, Katina. Take care, guys.
Thank you.